Hi, everyone. My name is Korrinne Yurick. It is an honor to be here with you tonight. I'm a physician assistant and the director of the Mobile and Street Medicine program at HealthRIGHT 360, which we launched in September with the generous support of Sutter Health. So I want to start by thanking again Jody, Will, and Shalini from Sutter. Your partnership made this possible, and we are so grateful. And thank you to HealthRIGHT's leadership team, especially Dr. Anna and Vika, for trusting me and my team to help bring this vision to life. At HealthRIGHT 360, we believe healthcare should be accessible to everyone. Those with and without insurance, people who use drugs, the immigrant population, the elderly, people with disabilities, and people experiencing homelessness. At our clinic on Mission in Van Ness, we provide excellent healthcare, but only to those who make it through our doors. When care only exists within brick and mortar facilities, those same clinic walls can be a barrier. For many, getting to a clinic is an impossibility. Survival comes first. People may be managing serious mental health conditions or substance use, or they may be living outside and must choose between going out to find food or going to their medical appointment. Some are afraid to seek care because of stigma, fear of being judged, turned away, or reported. So, we go to them. Street medicine is about going to the people, reaching people who would otherwise never go to a clinic. Instead of them seeking us out for care, we bring care to them in their reality. These are often people with the most complex medical and social needs who have been pushed furthest from traditional systems of care. Through our mobile medical van, we partner with local organizations like Martin DePore's House of Hospitality, Calle 24 Latino Cultural District, and One Treasure Island to provide on-site care in the Mission and on Treasure Island. And through our backpack street medicine teams, we make house calls to people experiencing homelessness. We meet people under freeways, on street corners, in RVs, and in shelters. On the street, we provide the same high quality of care that you'd expect in a four-wall clinic. We diagnose and treat urgent and primary care conditions, follow patients longitudinally, dispense medications, draw labs, perform minor procedures, and provide psychiatric health care, crisis de-escalation, and addiction treatment. We help people meet basic needs daily by providing water, food, hygiene supplies, and clothing. And we also do intensive case management, helping people obtain documents, apply for benefits, connect to housing, and enroll in and maintain Medi-Cal coverage. All these services, regardless of insurance or documentation status. I have some photos to share with you. Our program started in September of 2025. We started by providing services 1 day a week with a small team of 3. Now we operate 5 days a week with a team of 6. Since September, we've completed over 650 patient medical visits and have provided over 2,500 survival items, including pairs of socks, underwear, hygiene kits, food, and water. None of this work happens without our incredible team. And I want to take a moment to shout out our entire team, but especially my amazing nurse manager and friend, Dulce Barajas, who is sitting over there. Thank you for leading this work with me every day. Here are some photos of where we've been over the past few months. You can see us here on the right looking for one of our patients under the freeway. On the left, we're going to visit a patient in an RV. Here are some more pictures of us providing care in various locations throughout San Francisco. With our mobile and street medicine team, in partnership with Sutter Health, what we've seen so far is that people's health and well-being are improving. We are helping restore dignity to many who have felt outcast and overlooked. We are keeping people out of the emergency room by providing care earlier and more consistently, And most importantly, we are learning people's stories. We are connecting, creating community, and helping people to feel seen, heard, and loved. I want to end by sharing a story with you about Joseph, who gave me permission to share this tonight. We met Joseph at Martin DePore's Soup Kitchen, where we bring our mobile van on Mondays. Joseph has been experiencing unsheltered homelessness in San Francisco for a long time. He actually doesn't know how long because he unfortunately has severe dementia. When we met Joseph, we found out that he had previously tested positive for hepatitis C, but he didn't know of this diagnosis and he had never been treated. Hepatitis C is a serious infection of the liver. Left untreated, it can lead to liver fibrosis, cirrhosis, liver cancer, and possibly death. While this condition is treatable, it requires taking a medication daily for several weeks. This can be challenging for anyone, but especially for our patients living on the street. And especially for Joseph, because of his dementia, his memory doesn't extend much past a single day. But he always shows up at the same soup kitchen every morning. So we met him where he already was, at the soup kitchen, every single day to give him his medication. He completed the full 8-week course of treatment, and today Joseph is cured of hepatitis C. This is someone who would not have made it to a clinic appointment, who would not have been able to navigate a pharmacy independently, who would not have been able to manage an uninterrupted daily medication regimen on his own. But by bringing care to him, we were able to work together to cure his hepatitis C. We're so thankful for this outcome, but our work here is not finished. We remain committed to following up with Joseph, understanding his dementia, and finding stable housing. But Joseph is just one patient of the nearly 9,000 people experiencing homelessness in San Francisco. Research out of Boston Healthcare for the Homeless shows that people living unsheltered face an all-cause mortality rate nearly 10 times higher than those who are housed. We want to change this, but we can't do it alone. We need your help. At a time of growing funding cuts and system changes, the ability to continue and grow our street medicine work is more critical than ever. I invite you to join with us and Sutter Health in bringing hope and healing to those living on the streets of San Francisco. I've been doing street medicine for close to 10 years in Los Angeles and Pennsylvania, and I will tell you that this work is really, really hard. But it's also the most beautiful and sacred thing that I've ever had the privilege to be a part of. I have so much gratitude for all the people that I've met on the streets over the years, for allowing me to be a small piece of their story. I am grateful for those who I am now meeting on the streets of San Francisco every day, for my amazing team, and for all of you. This work is only possible because of the supporters in this room, and we're proud to be in this work with you together. Thank you.